Hi, Dr. Carmen Jones here. I'm a licensed naturopathic doctor, and I wanted to take a moment today to talk about hormones, specifically our female hormones, the cyclic nature, our estrogen, our progesterone, and even some hormones called LH and FSH, our luteinizing hormone and our follicular stimulating hormone. This is meant to be a just kind of lying the groundwork to understanding our hormones, how they change throughout our menstrual cycle, and where some of the challenges can be when they don't change in that cyclic pattern that we expect. Okay, so I'm going to use this visual graphic to explain things as we go. Um, Here we go. So this infographic is split up into two parts, the top half and the bottom half down here. Okay. The top half of the screen, this is what we call the ovarian cycle. You'll see that up here on the top upper right. And the bottom half of the infographic is our menstrual cycle. So the ovarian cycle, this is what's happening in our ovaries. The menstrual cycle, this is what's happening in the uterus. Okay. So these things are happening simultaneously throughout our cycle. Okay, let me introduce you to the players. Right, you'll see LH is this in the red. That's our luteinizing hormone. Our FSH is follicular stimulating hormone. And since this has to do with the ovaries and the eggs, these are the follicles that we're looking at. Okay, the second half of the infographic, yellow is estrogen and green is progesterone. And then down here in the pink, this is a representative of the lining of our uterus, which is what sloughs off when we have our period. So we're going to start at day one, which is usually the first day of bleeding. So on the bottom, you'll see day one is depicted where you kind of see the sloughing off. You'll also see it here on the far right side as well. So day one is usually when our period starts, when we start bleeding. That uterine lining is sloughing off. And so when that's happening, you see that there isn't a lot of growth in the uterine lining, right? And that first day of our period usually starts when there's no fertilization of the egg, and our body is expelling that excess lining because we don't need it. Okay. So if we start over here on the left side as day one, you'll see we're going to kind of break this up into the first half of our cycle and the second half of our cycle. The first half is that first 14, 16 days-ish. You'll see the biggest player is our estrogen. Progesterone is here. You can see this green stripe. It's present, but it's not the biggest player. Estrogen is. And the same thing you will see on the ovarian cycle is that FSH is a little bit more present during our menses or during our period, because you'll see it high at the beginning and then again you kind of see it high at the end. So what's happening in the ovaries during this time is that we have a lot of little follicles. As our estrogen slowly begins to rise, it promotes this luteinizing hormone that begins to rise as well. As our luteinizing LH hormone begins to rise, our FSH decreases. That triggers those follicles to start growing and maturing, to really set up to release that egg. Okay. The follicle is kind of the outer part that kind of protects the eggs. So as the follicle matures, we have this spike, right? Our estrogen, you can see on the bottom, has been increasing. That stimulates this LH and FSH spike. That triggers this ovulation. So our body, that follicle releases that egg. That egg goes from the ovaries and starts to travel down the fallopian tube. So down here, what's happening in the uterus is as that increase of estrogen rises, stimulates the release of the egg, you'll see the endometrium lining is starting to thicken as well, because it's thickening, getting ready for what we call that implantation, if it becomes fertilized. So the higher the estrogen, or this spike in estrogen, we see more thickening of the uterine wall. Once that egg is released, you see a drastic decline. You see these spikes, you see a drastic decline in the LH, and then even more in the FSH, and then you see this valley of estrogen. Okay, when this valley starts of estrogen, you start to see an increase in our progesterone. And our estrogen and our progesterone helps to kind of protect our body. So that progesterone, what it's doing is it is stabilizing the uterine lining so that it can increase blood flow, glands to form within that uterine lining, because it's really just setting up for implantation, right? It's setting up for that egg to come up the fallopian tubes, be in the uterus, get fertilized, and then it has a place to kind of stick in the uterine lining wall or implant so that it can start growing. So that progesterone is necessary in order for the lining to be stabilized, in order for you to have that blood flow to support the fertilized egg to grow. So you'll see estrogen is still a player. In the background, there's still a yellow hill because you have this valley. And then the progesterone and estrogen ratio is often what we look at when we're looking at when people suspect hormone imbalances, like their periods are really heavy, or they come really early, or they're having a lot of abdominal or pelvic pain, uterine cramping, those types of like PMS symptoms that we think of. This is usually what we're looking at, is the last half of the cycle in this play and this relationship between progesterone and estrogen. So if our progesterone doesn't match this estrogen, it's oftentimes when we can see symptoms can occur, or severe PMS can occur. So as the progesterone rises, you'll see in the background that estrogen is rising as well. Oftentimes, if you get hormones tested, like progesterone and estrogen, we want to be testing to be between days 19 and 21, so we can kind of see this peak of progesterone to see if your body's making enough progesterone to match your estrogen. And then they both decline. As that progesterone declines, oftentimes this happens when the egg is not fertilized. So then we also have a decline in our estrogen. And that decline is what triggers the sloughing off of the uterine lining, because our body says, okay, we don't need it anymore. So up here, also in the ovarian cycle, you'll see what we call the luteal phase. This is often where that corpus luteum will begin to grow, and if the egg is fertilized, it will begin to produce more progesterone to maintain a pregnancy instead of having this drop off when there isn't fertilization that occurs. And so we want this to drop if we're not planning on getting pregnant, but we need to match these cycles. Okay? So I like to share this graphic with folks because my goal is to help people understand why things change throughout our cycle. So if folks are bleeding at, say, day 21, or their cycle's a 25-day cycle, or a 20-day cycle, or even 19 or even 14-day cycles, instead of what we expect, the 28 to 30-day cycle, then oftentimes we can work on this progesterone and estrogen to help to support the stabilization of the uterine lining so that we can have a regular cycle of the 28-30 days before we start bleeding. Oftentimes, if sometimes people have really intense migraines, endometriosis, severe PMS, sometimes that can be because the estrogen doesn't decline here. You'll see this valley. We have one peak in estrogen, a valley, and then a second hill in the estrogen. Well, if this estrogen remains high and doesn't get this valley, then that can create pretty intense PMS symptoms, something that may look like an estrogen dominant picture, or sort of higher estrogen levels floating around in our body, which can wreak havoc and create symptoms. So, and then after that, right, day 28, 30, 31, then our body kind of resets, right? We slough off that uterine lining and then it starts over. That estrogen again starts to rise up till that ovulation, day 14 to 16. So I like to share this with people so we have an understanding of, we hear a lot about our hormones, right? We know about estrogen and progesterone, especially in women. We know that those are important, but we're not always taught, or we don't always remember what we're taught, and the relationship and how things change and what we expect. Okay. So if our hormones are out of balance, oftentimes we can support the body to recreate this pattern. Because oftentimes if we don't have this pattern, it's often because it's not just that our hormones aren't being produced adequately, but it could also be that the breakdown of the metabolism of our hormones are not happening appropriately in the liver or in the digestive tract. And so yeah, we can kind of manipulate that a little bit to help to support the body to create a sort of a cyclic environment in which it thrives, in which we expect. Okay. All right. I hope that helps. Feel free to stay tuned to some of my other videos about the relationship between our stress hormones, our cortisol, and these sex hormones, our estrogen and progesterone. Okay. Thank you for tuning in.